There is a sensation many of us know too well and almost none of us talk about. You finish a meal, or sometimes you simply swallow your own saliva, and there it is, that stubborn, maddening tightness right at the base of the throat. It feels like a pill stuck halfway down. It feels like a lump of bread that refused to push through. You sip water, you swallow again, you tilt your chin, and the feeling remains. It is not painful exactly, but it is present in a way that becomes impossible to ignore, especially at night when the house is quiet and the throat has nothing else to distract it. You have felt it. You may have blamed it on stress, on dryness, on something you ate too quickly. But what if that stuck feeling is not in the food at all? What if it is in the house itself, in the wiring of your throat, in the plumbing that connects your mouth to your stomach, in a system that has quietly been changing for years beneath the surface of every swallow you have taken since your 60s? The crisis I want to sit with you about today is not an emergency in the dramatic sense. You will not collapse from it. You will not be rushed into surgery by it. But it is the kind of crisis that eats away at the simple pleasures of living, the comfort of a slow meal, the joy of a laugh without the catch, the calm of laying your head on the pillow without that lump chasing you into sleep. And if we let it run unchecked, that stuck feeling can become the doorway to something far more serious, like aspiration that sends food into the lungs, like a choking scare that lands you in the emergency room and out of your own kitchen for weeks. The good news is that the doorway can be closed, and it can be closed with adjustments so small that you will begin to feel the relief before you finish this conversation. Let us name what we are really feeling, the way a good doctor would name it across the desk from you. The medical world calls this globus sensation, sometimes globus pharyngeus, the sense of something stuck in the throat when nothing physical is actually there. For decades, doctors told patients that globus was mostly in their heads, a fragment of anxiety, a nervous habit. We were wrong about that, and I want to walk back that mistake with you, because the truth is far more respectful of what you have been feeling. Globus after 60 is almost always a physical signal, a message from aging tissue, from worn valves, from a plumbing system that needs a little more care than it used to. The first place to look is the gateway at the top of the stomach, a small ring of muscle called the lower esophageal sphincter. Think of it as a turnstile at the door of a busy building. When we are young, that turnstile swings shut with the confidence of a well-oiled spring. When we cross into our 60s, and especially if we have been on certain medications for blood pressure or for sleep, that turnstile begins to weaken. Stomach acid drifts upward where it has no business going. Most of us think of reflux as a burning sensation in the chest, but as we get older, the burning often fades, replaced by something quieter. The acid climbs higher into the upper throat, into the larynx, into the very tissues that line the swallowing tube, and it inflames them just enough that they do not slide past each other smoothly any longer. That is the stuck feeling. It is not a piece of food. It is inflamed tissue, whispering in the language of tightness. Now let us look at the second cause, the one that almost no one ever discusses with patients, and it is this: the bone spurs that grow along the front of the cervical spine as we age. The spine is a tower of building blocks, with cushions between them to keep the movements gentle. As the decades pass, those cushions thin, and the body lays down extra calcium to stabilize the tower. Sometimes those calcium deposits form small, hard ridges along the front edge of the vertebrae. When they grow tall enough, they press gently, steadily on the back wall of the swallowing tube that sits directly in front of them. Picture a garden hose pressed between a wall and a heavy stone. The water still moves, but slowly with friction. That is what is happening inside your throat when you feel that lump. And the reason it gets worse when you swallow pills or dry bread is because the harder material presses more firmly against that ridge of bone. When you understand how a bending spine can press on the throat, you will see why so many thoughtful patients have joined our community by subscribing to receive these weekly health blueprints, so that the small mechanical truths of aging stop becoming silent scares. The third layer is the muscle itself, the myenteric plexus, the wiring system that coordinates every wave of swallowing. Think of the throat as an old elevator system. When you were younger, the cables were tight, the motor was responsive, the buttons lit up the moment you pressed them. Now the cables have stretched. The motor hesitates a beat, and what used to be a smooth ride is occasionally a stutter. The muscles of the pharynx lose mass. The nerves fire slightly out of sync. The wave that pushes food downward loses some of its rhythm, and small particles or simply saliva can sit briefly where they should have already passed. This is not weakness. This is wear, and wear is something we can support with the right habits. Before we go further into solutions, let me share the dangerous mistake that I see in patient after patient, week after week, and it costs them dearly. The mistake is ignoring the stuck feeling and compensating in the wrong way. Many of us, when the throat feels tight, begin to wash every meal down with large gulps of water. We swallow more forcefully. We clear our throats repeatedly throughout the day. We avoid certain foods, like dry bread or tight pills, and we narrow our diet down to soft soups and mashed potatoes. On the surface, this feels like a wise response. In truth, it is making the underlying weakness worse. Forceful swallowing strains the same muscles that are already losing coordination. Repeated throat clearing inflames the very tissues that are trying to heal. And narrowing the diet to soft foods loses us the gentle exercise that ordinary chewing and swallowing provide to the throat muscles. The throat, like every muscle after 60, needs to be used correctly, not coddled into decline. There is a secret fourth layer that I want to mention now and reveal fully at the end, because understanding it will tie every other cause together into a single picture. That fourth layer is the medication cabinet. Many of the pills that protect our hearts, our blood pressure, our sleep, our bones, do something that is rarely explained at the pharmacy counter. They slow saliva production, they relax the turnstile at the top of the stomach a little more, they alter the rhythm of the swallowing nerves. None of them alone would cause a stuck throat, but together, layered over years, they create the perfect environment for globus sensation to take up residence. We will come back to this layer in the final minutes with concrete adjustments you can make, and a conversation to have with your own doctor. Let us take a moment for the hidden warning that has been sitting quietly under everything I have just described. When we feel a stuck throat, our first thought is almost always that something is wrong with the throat. And sometimes that is exactly right, and sometimes it is not. The hidden warning is this, that a persistent stuck feeling, especially when joined by unintentional weight loss, by hoarseness that lasts more than 2 weeks, by pain that travels to the ear, or by coughing that wakes you from sleep, is the body's way of asking for a proper examination. It is not a betrayal of the body's plumbing to bring this up. It is the most respectful response we can offer to a system that is communicating with us. And the reason I emphasize this now, near the middle of our talk together, is that no amount of kitchen wisdom or bedside habit will replace a proper look down the swallowing tube if the warning signs have arrived. Now we come to the step-by-step home solution, and it is built on 5 gentle habits that I have laid out for hundreds of patients and for my own parents. Habit 1 is the slow swallow reset. 3 times a day, ideally after each main meal, take a single small sip of room temperature water and swallow it with full, deliberate attention. Not hard, not gulped. Just a quiet, intentional swallow the way you would tip a teacup with care. This small act, repeated, reminds the throat's coordination system how to fire in sequence, the way a gentle scale reminds a stiff piano how to play. Habit 2 is the posture before the plate. Most of us eat at a kitchen table where we lean slightly forward, our chins tucked down toward our chests. That position narrows the angle at which food enters the swallowing tube, and it increases the very friction that creates the stuck sensation. The simple correction is to sit tall, to plant both feet on the floor, to bring the chin slightly down and the shoulders back, and to take the first 3 bites of every meal with the awareness that posture matters. You will feel the relief within days, often within a single meal. Habit 3 is the moistening habit, and it applies especially to pills. Many of us take 3, 4, or more prescribed tablets each morning. We swallow them dry because we have done it so often we forget that the throat has aged along with the rest of us. Before each pill, take 1 sip of water to wet the lining of the throat, then a small bite of soft food, like plain yogurt or a piece of banana, and then the pill. The throat will thank you in a way that no supplement bottle ever could. When you understand how a moistened throat slides comfortably past its bending spine, you will see why so many of your fellow viewers have committed to subscribing. So they never miss another wellness blueprint, because this kind of detail, repeated daily, is exactly how dignity at the table is preserved. Habit 4 is the evening reset for reflux, and this is where we begin to close the loop on many of the causes sitting at the top of the stomach. Stop eating 3 hours before bed. Raise the head of the bed by 4 inches, not with thick pillows that bend the neck, but with a stable wedge under the mattress or risers under the bedposts at the head. Avoid tight waistbands in the evening. And if your doctor agrees that it fits your case, a gentle over-the-counter acid calming routine, taken 30 minutes before dinner, can quiet the upper throat inflammation that contributes to the stuck feeling. If those measures still feel incomplete, Speak with your doctor about adjusting medications that are known to relax the stomach turnstile. Habit 5 is the swallow that protects sleep. Before you lie down for the night, take 2 deliberate swallows of plain water. Not because you are thirsty, but because you are signaling to the throat that the day is closing and the muscles should rest. People who do this consistently tell me they wake with less of that morning lump, less of that tight band that greets the day. It is a tiny ritual with outsized impact, and it costs nothing. Let us honor the senior psychology layer once more, because this is where the clinical advice translates into life. The fear we share, the unspoken one, is not just the fear of choking. It is the fear of being moved away from our kitchens, away from the table we built our family around, away from the daily small dignity of feeding ourselves. Every step we have just walked through, the slow swallow, the posture, the moistening, the evening reset, the bedtime ritual, is a way to keep that table as your own. None of these habits require equipment. None require permission. They can be done in your own kitchen, with your own cup, in your own chair, before the same window where you have watched 10,000 sunrises. Now let us bring in the clinical nuance that ties it all together, because understanding this difference will change how you think about every health recommendation you receive for the rest of your life. Treating the symptom of a stuck throat might mean sipping more water, taking antacids, avoiding certain foods. Restoring the function of the throat means working with the muscles, with the nerves, with the valves, with the spine that now collaborates with your swallowing tube in a different way than it did at 40. That is what we are doing in these 5 habits. We are not masking the sensation. We are restoring the strength, the coordination, the moist surfaces, and the calm chemistry that allow a swallow to feel like a swallow again. Before we close, here is the permanent prevention practice that I want you to carry into every meal for the rest of your life. Once a week, ideally on a Sunday, take 3 minutes to walk through the 4-question routine I teach every patient. First, am I eating slowly enough today? Second, am I sitting tall or am I leaning? Third, have I scheduled my evening without food near the bed? Fourth, and this is the one most often skipped, am I bringing any new medication, any new symptom, any new tightness into a conversation with my doctor? This 4-question weekly check is the smoke detector for the kitchen table. It catches the small drifts before they become big problems. When you commit this 4-question ritual to memory, you will understand why so many of your neighbors have flagged this channel by subscribing. Because health independence after 60 is built one quiet weekly habit at a time. And now I will reveal the secret 4th layer I planted at the beginning, the one that quietly amplifies the other 3. The layer is the medication conversation. Many of the pills we take for blood pressure, especially calcium channel blockers like amlodipine and similar drugs, gently relax smooth muscle throughout the body, including the turnstile at the top of the stomach. Many of the pills we take for sleep, especially benzodiazepines and certain antihistamines, dry out the mouth and slow the swallow reflex. Many antidepressants affect nerve signaling in ways that alter the rhythm of the throat muscles. None of these effects is dramatic enough to be warned about in a single conversation, but layered together, over years of daily use, they form a quiet contributor to the stuck throat you may have been blaming on the bread you ate or the stress of the day. The solution is not to stop the medications. The solution is to bring the conversation to your doctor calmly and clearly, so the medication list can be reviewed for combinations that may be adding to throat symptoms, and so protective habits can be layered on with confidence. Let me bring all of this home with a final image. Imagine the house of your body, with its kitchen, its dining table, its winding staircase. See, that leads to a quiet bedroom upstairs. The throat is the central hallway of that house, the hallway every meal must travel through to be truly nourishing. The bones of the spine, the muscles of the swallow, the valves at the stomach door, the moisture of the saliva, the chemistry of the medications, all are parts of that same hallway. When even one of them quietly slips, the hallway narrows. When several slip together, the sensation of something stuck begins. The work we have done together in this conversation is simply a matter of resolving that hallway, restoring the width, restoring the calm, restoring the comfort that allows every meal to be enjoyed. You came to this message because some part of you recognized the description from earlier, that tightness, that lump, that feeling that nothing quite gets through. That recognition is not a weakness. It is a quiet wisdom, the body's way of asking you to please pay attention. The good news is that the kitchen, the table, the chair, and the slow sip of water already hold everything you need. You do not need an expensive device, a fancy clinic, or a long list of forbidden foods. You need deliberate attention to 5 small habits, and the courage to bring one quiet conversation back to your own doctor. If you take only one thing from today, let it be this. The bridge between today's stuck throat and tomorrow's choking emergency is built one poorly timed swallow at a time. But that same bridge can be dismantled, one slow water sip, one tall posture, one peaceful evening without food in bed at a time. Stay home. Stay well. Stay the CEO of your own kitchen table. And the next time you feel that familiar tightness at the base of your throat, you will remember not to clear it harder, but to soften it with breath, with care, with the same wise attention you would give a beloved chair that has begun to creak in the night. That is the heart of medicine I practice, and it is the heart of every blueprint we share, one swallow, one meal, one independent morning at a time.